Good afternoon, everyone. Thank you for that kind introduction. Actually, I was surprised because I only submitted a one-page CV, and yeah, maybe I'm not sure, no, who submitted that my complete a CV. But anyway, I'm sure we were spellbound by the lecture of Dr. Bernal. No, it was really inspiring and exciting, and I think he can keep on and on with that kind of lecture. While I was listening to his lecture, I remember around 26 years ago, when I was starting my fellowship at PGH, and we were instructed to attend a meeting by a Filipino scientist on biotechnology, and lo and behold, it was Dr. Sam Bernal. And then 26 years again, so we meet, no, in this forum. So it's very significant. Okay, so I know we were, for us, I think for a regular Filipino, a stem cell therapy is still a fantasy, a dream, but I think my lecture it's a reality for us, for everyone. So I will talk about the clinical development of a tetravalent dengue vaccine, but I was told that there are non-medical people in the audience, so I will just give a brief information about the disease. Okay? In a survey done among doctors and parents about what are the most treated diseases, and you know what? The number one was dengue. Okay? Next. Down? It's down. Oh, I'm sorry. Okay. In the medical scientific community, based on data submitted from most countries of the world, dengue is the most rapid, a fast emerging arboviral infection, which is present in more than 112 countries and territories. It is transmitted by mosquito-borne flavivirus infections, the Aedes aegypti and Aedes albopictus, and the four virus has been isolated in all tropical countries. Well, of course, we know that there are conditions which likely increase the risk of transmission and vector breeding of these mosquitoes, and like for one, in unplanned and uncontrolled urbanization, we see overcrowded areas in all over the country. Human practices and domestic conditions, which I think are self-explanatory, and increased travel, movement of population. So it's now easy to travel, and we just don't know, for example, that a person who is incubating the virus or has the virus within her body goes to another country or to another area where there are circulating Aedes albopictus or the Aedes mosquitoes. So that's it, no? So, and then of course the climate change, because there are now reports of countries where initially dengue was not present, but now we see this dengue disease among the population. So with these identified risk factors for the transmission and increased vector breeding, dengue is a global public health challenge. It is 2.5 billion people at risk in over more than 100 countries, up to 100 million people infected annually, 500,000 dengue hemorrhagic fever, the severe form which is more commonly seen in children, and about 2.5% of those badly affected die. Okay? Behind these happy faces of these Asian children is a growing problem of dengue in the region, in the Asian region. Dengue hemorrhagic fever is a leading cause of hospitalization among these children. 90% of the subjects are children less than 15 years of age. In the 75% of the global burden are in our region. In the Southeast Asian region, where like Thailand and Pakistan and India belongs, and in the Western Pacific region, where Philippines, Singapore, and other neighboring Asian countries belong. And since 2003, the trend is towards the rising number of dengue cases. In the modern history of dengue, modern because it is said that between the 17th and the 19th century, dengue infection has been around. Modern is just in the more recent dengue history that did you know that the first dengue hemorrhagic fever epidemic was in the 1950s in Manila, when it was said to be Manila during this period was the most beautiful city in Asia. Okay? And as they say, the rest is history. Well, in the country, we are aware that dengue problem is worsening. A total of 137,000 cases was reported nationwide as of October of this year, higher, 26,000 cases higher compared to the same time period last year, okay? And most of the cases were from the following regions. NCR, of course, where Metro Manila belongs, and the Region 4A, Region 3, and the age of cases range from between 1 to the most senior, 90 years old, and the median age is around 12 years old. And 40% of cases belong to the 1 to 10-year age group. Majority of the cases, slightly over males, and there were 329 deaths, or a case fatality rate of 0.6%. We must be quite alarmed because, like in Thailand, their case fatality rate is less than 0.1%. Okay. Well, just to give you just an overview about the dengue fever is caused by this dengue virus. Well, it's not in terms, because kung sana maganda yung color, I mean, you can see clearly just under the electron microscope how it looks like. And then mosquito vectors, we all know Aedes aegypti and albopictus, and transmitted through the bite of infected female mosquitoes. And each serotype provides lifetime immunity. What does it mean? Which means that if you are infected by a specific serotype, for example, you were infected by dengue serotype 1, you will be protected against serotype 1 for life. You will have a short protection, maybe 3 to 6 months following infection to another serotype, but ganun lang, it's just a short protection from other serotypes. In combating, in fighting the dengue disease, one of the most important thing to do is knowing the burden of the disease, no? So it's through the surveillance that we will know the nature or the burden of the disease in the country. And the Department of Health has this surveillance. It is in charge is the National Epidemiology Center of the Department of Health, headed by Dr. Eric Tayag, and together with the Research Institute for Tropical Medicine, where the Department of Virology is a national reference laboratory for dengue. So we do side by side confirming this dengue patients which are hospitalized, and they send serum to RITM, and we confirm if this is really dengue, and then we looked at the dengue serotype. So this is the serotype landscape in the Philippines. Well, it's very important because in the dengue vaccine, it's very important. We said that an ideal dengue vaccine should be tetravalent. That means it should protect against all 4 serotypes. So what are the common serotypes in the country for the past maybe 5 years? The most predominant dengue serotype is dengue type 3, followed by 1 and 2, and then dengue type 4. Although this year, it's dengue type 2, which is increasing number, which means in developed countries, in industrialized countries, like in Singapore, they have a very good active surveillance. They have found out that when you have a new emerging serotype, so you watch for like an epidemic or outbreak. So for the past 5 years, we have dengue serotype 3, and now we have an increasing number of dengue serotype 2. Okay, so just to give you just a brief mention about the laboratory diagnosis of dengue infection. I think you have heard from a friend, from a family member that a child, for example, has been diagnosed to have dengue fever by a doctor, but it turned out that the laboratory test for dengue turned out to be negative. Well, pwede yun mangyari, no? So, when we give lectures to our colleagues, to our doctors, so we emphasize that it is very important when to request the test and what kind of test should be requested during the time that the patient is sick, okay? Because when the mosquito bite, when one is bitten by a mosquito and then a virus goes into the body, it's about 3 to 4 days. The maximum could be more than a week that the virus is present within the blood, but at the same time, the patient is asymptomatic. So no fever, no signs of symptoms, but the virus is still already in the blood. And then the patient becomes symptomatic, okay, during this period with fever, with headache, with body aches, with no appetite. So it is during this period when there is viremia, that means the dengue virus is within the blood, that you request for this kind of test. The PCR, so virus culture, usually we do it in our research patients, PCR and the NS1 antigen test, which are all available in most hospitals, okay? And then after around 5 to 6 days, so your virus disappears and the antibodies against the virus comes in. That's the time that you should request your dengue IgM and your IgG antibodies. So, yon, dapat dito na. So, because sometimes you request this test during this time, the earlier phase of the disease, so hindi talaga madidetect ang antibody, okay? Okay, so, well, we know that the dengue has a broad spectrum manifestations, no, from mild to moderate to severe dengue, but yet the management is relatively simple. At present, we know that there is no specific therapy. Unlike other infectious diseases, there is no antibiotic specific against dengue because it's a viral infection. And supportive measures are usually given: adequate hydration, paracetamol or acetaminophen. But, so we always emphasize to the doctors that you don't have to give around-the-clock paracetamol, because you expect that during this time your patient is febrile while there is virus in his or in her blood, no? So don't give, even for us mothers, so you don't have to give paracetamol round the clock, because it will not lyse or it will not stop the fever, okay? And also it might induce hepatitis or some hepatic problem, of course, affecting the liver, okay? So you just give when it's around more than 39 degrees centigrade, and it should not be even less than 4 hours interval, okay? So we always emphasize that to our doctors. And of course, the essence of management of dengue is a judicious use of intravenous fluid therapy. So, and there, if it's needed, the child is hospitalized, and what is important is that we closely monitor our patient. Okay. Well, so we know that there are a lot of breeding sites, so a variety of breeding places in the dengue mosquito in our surroundings, and in terms of prevention and control, I think it's everyone's concern, okay? And so yun, sabi dito, without containers, there is no mosquito. Without mosquitoes, there is no dengue, okay? So, we move on to about dengue vaccine. Scientific discovery related to dengue started more than 70 years ago. So ganoon katagal, no? It started with isolation of the virus and then identification of the four serotypes until it came to the development of a monovalent dengue vaccine. Yung noon was just protection against one serotype, against serotype 1. And then there was later on the development of a live attenuated tetravalent vaccine, but it was stopped because it brings like a high fever among the subjects, no? And now we have the leading dengue vaccine candidate, this one. So that is during this period between 2004 and 2007, we started the clinical trials of dengue vaccine in the Philippines. And it has progressed into several clinical trials, and then the most recent one is efficacy trials. Okay, so there are several, no? Developing a safe and effective dengue vaccine has been a challenge for so many years among scientists, among researchers. Why? Why has it been so difficult to develop a dengue vaccine? One, there are 4 different serotypes. So you have to combine a vaccine that will protect against the 4 serotypes, no? So of course, we expect technical difficulties, inter-serotype competition, and there should be a need for a balanced protection against all 4 serotypes. And then there is no laboratory animal model that will mimic dengue disease caused by dengue virus, no? Sa mga earlier preclinical trials, that means among animals, it has not shown that animals develop a hemorrhagic type of fever unlike among humans, okay? And then there is a theoretical risk of antibody-dependent enhancement, or ADE. That means, so there's a need for a combined tetravalent vaccine, no? So among doctors, when we finally found out that our patient, so the parents would say that this is the 2nd or the 3rd type, that the patient has been admitted for dengue infection, we are more apprehensive because it is said that the setting of a secondary dengue disease, so we expect more complication, more severe manifestations. Although it's quite controversial at the moment because there has been report that so far ADE, it has not really been seen in most studies, and also there are other factors which affect the severity of the infection. And there is no correlates of protection. So for every vaccine that will be developed, it needs an efficacy trial. So what does an efficacy trial means, that's the last phase of clinical development, or the clinical phase of development prior to the licensure of a vaccine or a drug. Okay. So, well, we all know that there are dengue vaccine candidates being developed, so we have one, which is the leading dengue vaccine candidate, which is now in phase 3, okay? So this is a live attenuated vaccine using a DNA technology wherein the immunogenic properties of the virus, yung kanina sana, kung nakita natin, there's that around, yung sa virus outside is the pre-membrane and the enveloped protein of dengue, itong ganito. So these are said to be protein which has the immunogenic properties. That means once it's identified by our immune system, so our immune system will elicit antibodies against it, okay? And these structures, and here we have another, the yellow fever vaccine. Ang loob nito, no, this will be combined with the outside, the PRM and E, and so we have the chimeric vaccine. So outside is the dengue protein structural antigens, and inside is the non-structural and capsid protein of the yellow 17D vaccine. Okay. This development of the dengue vaccine is strengthened by several guidelines that is recommended by the World Health Organization. Okay. The development of a dengue vaccine has been ongoing for several years worldwide. That means in partnership with several countries around the world to answer the fundamental question of safety, immunogenicity, and efficacy. So hindi lang clear dito, but there are a lot of 5 phase 1 studies in Europe, in US, in Australia, in Asian countries, 12 phase 2 studies all over the world again, and also 5 phase 3 studies again in Asia, in Latin America, in Australia. Okay? So hindi lang klaro dyan. And all these phase 2, so a majority of those are phase 1, phase 2 studies, which showed that, it's not clear, this is a very safe vaccine, no? Safe vaccine, well tolerated, with a balanced immune response against all 4 serotypes. It's not clear here, no? But the essence is that it's a very safe and tolerated and immunogenic, which means the vaccine elicits adequate antibodies against the virus. So, in the Philippines, we have been in the forefront in the development of a dengue vaccine. The Department of Health, ever since we started with the phase 1 study, with the phase 2 study, with the phase 3 study. So the Department of Health has been coordinating and participating in this vaccine, dengue vaccine clinical trials. Which aims, of course, is to assess the efficacy of this vaccine against, to prevent asymptomatic, that means symptomatic dengue against any caused by the 4 serotypes, and this should be virological confirmed either by PCR, by NS1 antigen test, and after 3 doses. Hi, what happened? What can someone help me with the what's yeah, okay, next please. Next please. Okay, so in 2009, so I'll just, because I've said that phase 1, phase 2 studies and phase 3 has been ongoing, and in 2009 the first efficacy study has been conducted in Thailand. The preliminary analysis completed in 2012, and presently there are follow-up surveillance ongoing. In 2011, 2 large-scale efficacy trials initiated in Asia and Latin American countries. And in Asia, in Latin America, in Colombia, in Honduras, in Mexico, in Puerto Rico, Brazil, with the age range 9 to 16 years old. And in the Philippines, in Asia, together with Thailand, Indonesia, Malaysia, and Vietnam, with the age group 2 to 14 years of age. In the Latin America, so 20,000 children has participated. In Asia, more than 10,000 children, 2 to 14 years of age. So far, in the Philippines, so we have enrolled 3,501 children. We have completed the 3 doses of the dengue vaccine last first week of October. Okay, and this is the one. This is the CYD 23 study in Thailand. So in all these efficacy trials, 3 doses are administered with 6 months interval, and there is an active surveillance, school surveillance, and hospital kind of surveillance. Okay. So just to give you about the result from Thailand, this is the first efficacy study, which was published in the Lancet journal last September. It showed that the efficacy was just around 30%. The lack of efficacy against serotype 2 in this setting, which was at the time during the conduct of the study, there was several epidemic and outbreak due to dengue serotype 2, and it reduces the overall efficacy to 20%. And evidence of protection against serotypes 1 was 61%, serotype 3 was almost 82%, and serotype 4 was 90%. Cool. So, in terms of overall conclusion, it's a study that demonstrates that this is the first time that the vaccine against dengue vaccine is possible, against dengue disease is possible. It is excellent, it has excellent safety profile observed, well tolerated with no safety signal identified, comparable to control and consistent with observations from previous studies, and no enhanced disease in breakthrough infections over 2 years. Actually, in the Philippines study, we have almost like a 5-year follow-up of those being given the dengue vaccine from 2 to 40 years of age. So far, maybe 2 has developed a minor dengue disease, very mild, unlike, for example, they have siblings who were hospitalized for dengue. And then the immune response was consistent with previous studies, good antibody responses. Additional data will be provided by ongoing large-scale phase 3 studies, I have said earlier, in Asia and Latin America. So the study in Thailand is just the beginning, just the first among 30 more study sites around the world, okay? And challenges to vaccine introduction into endemic countries in Southeast Asia include having a clear and accurate epidemiological picture of the disease, funding, and of course, logistics. Okay? So this one, whenever I give a lecture about dengue vaccine, so I always present this picture because this was taken when we were preparing for the dengue vaccine clinical trial. This was because there are 2 sites, in San Pablo City and Cebu. I'm the national coordinator for the dengue vaccine clinical trial. Principal investigator interested to know about clinical trials on dengue vaccine, and lo and behold, there was a jam-packed gymnasium. No, so you can really see the intent, the intent of parents hoping and very interested and hoping for a dengue vaccine in the future. Okay, so thank you for your attention.